Dr. Norman's discussion and his questions bring to light that is where privatization is an option for providing cost-effective and innovative services. It's not the only option, and it's not always the best option, but it is an option that's prone to misunderstanding and misapplication by policymakers looking for a quick fix in what are pretty tough economic times. So with this, we just wanted to describe a little bit the failed privatization proposal with income maintenance, which really would have had some very direct impacts for the La Crosse community. How such a proposal gained serious consideration, call that the dangerously simple allure of privatization, and some of the takeaways from this experience. And just so we're on the same page in terms of when we're referring to income maintenance programs, we're talking about food share, which is also commonly referred to as food stamps, basically food assistance for low-income individuals, medical assistance, health care insurance for those elderly or blind or disabled individuals, but also health insurance, that's the MA Badger Care program for low-income individuals and families. And when we're talking about income maintenance administration, as far as who's responsible for that, well, at the beginning of the privatization proposal, mostly county and tribal governments, meaning that it was administered by local government employees. What's involved with that is determining initial eligibility for benefits, looking at things like income and age and family status, and then regularly reassessing eligibility based on if there are changes in circumstance. And in terms of performance measures, measure performance, are you determining access to those benefits in a timely manner, which is very important. We have people that come into our apartment that are out of food now, that have families to feed, that have been putting this off because it's embarrassing to them. And it's important to have those applications processed in a timely fashion. It's also important to do that so accurately and with good customer service. So if someone has an emergency or calls, you're able to respond in a quick and appropriate manner. So a little bit about the privatization proposal. Really, in the biennial budget, Governor Walker proposed two core changes to the administration of income maintenance. First, proposed to centralize the function and really transfer the administration from counties and tribes, from those localities who were doing that, to a newly created centralized income maintenance unit. But then secondly, get authority to privatize this function, authorize the state to contract with an entity to take most of this function over. So those were the two core changes, and so that was a monumental change, and it impacted approximately 1,000 local government workers across the state who would have lost their jobs and would have been replaced by contracted employees had this proposal gone through. It was also a major change in terms of that service delivery model. But considering that was such a huge change in scope, there was no consultation with local governments or affected interest groups before this proposal was launched. There was very little planning. This was so secret that our liaisons in the Department of Health Services were caught off guard and kind of at loss for words the day after this came out. The Department of Children and Families was impacted by the proposal, so another department of the state government was unaware that some of this was coming out. So really the day the budget hit, we were left interpreting this and explaining to 26 workers in our department whose job were essentially wiped out by this proposal, what it all meant. So I guess you could say that this was a pretty abruptly announced privatization. But also with that, it had a major impact in the community. We look at La Crosse County and the recipients of income maintenance benefits for the Medicaid, elderly, blind, disabled, 6,000. Food share, 12,000. If we're looking at the level of need in the community, the number of individuals on food share benefits had risen 75% in the last four years. It's talking about the measure of need and the impact of the recession. And Badger Care, about 13,000 recipients. But in terms of an unduplicated case count, 18,000 recipients of IM benefits, which is really 1 1 in 6 of the county population. So in some form or another, coming into a local income maintenance office, sitting down face-to-face with the worker and getting those benefits. And really a staggering $125 million in annual medical assistance reimbursements to area healthcare providers. Human Services falls into that healthcare provider category. Our budget depends on $4.6 million of MA revenue from individuals who are eligible for MA, receive MA benefits. We provide counseling services and other services, and then are reimbursed because they have that eligibility. $13.7 million of cash flow to local grocers from food share benefits. When this was disrupted because of staff food and income maintenance determinations in Milwaukee County, those local grocers were the first to cry out that they really felt the hit of that. But then also 26 jobs in the Human Services Department that were tied to administering income maintenance programs. Now the justification for this that was in the budget documents, and some of those mirror just what was described by Dr. Norder, was one, more efficient, that this would improve the efficiency of income maintenance eligibility determinations. That's from the governor's budget and brief. But also provide better outcomes that would improve the accuracy and timeliness of eligibility determinations. And if that justification had been based in reality and accurate, it could have been easier to accept. I think our jobs as public servants, and if there's a better way to do things, so be it. But the problem was, we had seen this private model in action. Since 2008, the state had operated a private model entity called the Enrollment Services Center that provided eligibility determinations for a certain segment of Badger Care and food share recipients. And we were able to see firsthand how that was working, because a lot of those individuals also had regular Badger Care benefits and other benefits, so we seen them in the department. And we saw how they would be on our phone, our lobby phone, for 3 hours waiting on hold to get through, to have a change and to apply for benefits. We saw where some of the benefits weren't processed for 6 months to a year. So we saw firsthand how this wasn't working. But again, this had been in operation since 2008 for those benefits. As of March 2011, that operation had 482 employees. 432 of those, so almost all of those, were in contract employees employed by Hewlett-Packard HP Enterprise Services. And really the governor's income maintenance proposal was essentially an expansion of this private model for public assistance. So seeing this and seeing how this was bad for efficiency for the clients we served, quickly worked with our counties association and tried to provide some facts behind the anecdotal evidence that we're seeing. So we really took a look at, okay, how was the private operation doing in terms of case processing time compared to our public operation? We found out that statewide, we looked at all the counties, about 75% of the cases were processed in 30 days.